Hi everyone, this is Dan with ThoroughCare. I recently did a webinar where I talked about the changes to the upcoming 2024 physician fee schedule. One of the highlights of the webinar was talking about a new program called Principal Illness Navigation, or PIN. I hope you enjoy this video as you explore whether PIN makes sense for your organization. There's one more new program on the care management side, and it's called Principal Illness Navigation, otherwise known as PIN. So what is PIN? It's a new bundled payment, and this one is designed to manage one serious high-risk condition. So imagine something like cancer, for example. It needs to have a patient-centered assessment, and the assessment is designed to better understand the individual context of this one serious high-risk condition. It expects you to identify the referring patient and appropriate services, such as caregivers, family support, so who the patient considers their support system. It expects you to identify appropriate services, such as home health care, community-based care coordination, provide education to the patient that talks about this one condition and what treatment plans are available. What are some goals that they have to supposedly manage throughout the program, and then help that patient through providing self-advocacy skills so that they are more knowledgeable about their condition and can better interact with members of their care team. They expect you to navigate the healthcare system, find appointments with the right specialists, appropriate services. If they have a need for behavioral health services, you would be expected to facilitate that. And finally, provide mentorship and support, inspiration to help them meet those treatment goals. So there's a lot that's expected. Again, I think groups might do a lot of this in some of their existing programs like PCM and CCM. But to do this program, your patient must have one serious high-risk condition, and that condition must be expected to last at least 3 months. And CMS is using this language, places the patient at significant risk of hospitalization, nursing home placement, acute exasperation, decomposition, functional decline, or death. So that is direct from the CMS requirement for this program. How do you get paid for it? Well, again, this is a certified or trained auxiliary personnel code under the general supervision of the provider. So all of these codes, the provider themselves does not need to do the work. Just like CHI, there's a 60-minute code, and then there's an additional 30 minutes per calendar month code. So PIN, $79.25, you would bill under G0023, the 30-minute code, G0024. Now, there's 2 more codes that were added, and this is for peer support by the certified or trained auxiliary personnel. If the patient has a behavioral health issue, there's their own version of these codes, G0140 and G0146. And again, the payment rates are exactly the same between the 2 programs here and also the same as CHI. All right, same limitations under for PIN as CHI. Again, as I read through that list, those of you might have thought, well, I do a lot of those education and services and management of the conditions under CCM. And again, CCM pays significantly more. 20 minutes of CCM, $62.69. You can spend 40 minutes and you get $110.13 compared to the $79.25. And then for the behavioral health part, even general BHI, while you get $79 for PIN, you get $54 for 20 minutes of behavioral health, only 20 minutes. So again, use your own judgment, but in my opinion, I think this is a limitation for year 1. And keep in mind, whenever CMS releases a program, the trend that we see is that the programs always get better over time. CCM wasn't very good its first year, RPM wasn't either, but hopefully CMS may adjust these programs so that you do get paid a whole lot more. In our opinion, that's a limitation for sure. If you'd like more information about the 2024 physician fee schedule, please see the links below. If you found this video to be helpful, please like it below and subscribe to our channel so that you get all of our updates. Thanks for watching. Goodbye.